Hi, I'm Cindy Crook, Director of Marketing at Duncan Regional Hospital, and welcome to Facebook Live. Today we're here with Dr. Crystal Vonfeldt, and we're going to be talking about vaccinations, that fun topic that makes many children and many parents cry, but they're very important, and that's why we asked Dr. Vonfeldt here. So welcome.
Thank you.
Go ahead.
Hi, so I thought I would touch base. There are long conversations that can be had about vaccines, but I'd like to touch on three of the common ones that we think about this time of year. The first being the meningococcal vaccine. This is a vaccine for children and adolescents and teens starting at age 11 up to 18. It protects you against the bacteria Neisseria meningitidis, which causes meningitis, which is a dangerous, life-threatening infection to the brain and the nervous system. This vaccine is particularly recommended for people who will be in large groups such as dorm environments. So this is something we really like to think about with our graduating seniors about to go to college, as well as our brave men and women who are about to join the military and go into military training, where they'll be in bunks and large groups of people. This is also a vaccine that is given to pediatric patients in a very small subset, particularly those who don't have a spleen or spleen that works very well. Your spleen is an organ that sits in your stomach that has to do with cellular immunity. It helps scan your blood for bacteria that are encapsulated that help protect you, and particularly children with sickle cell disease or immune deficiencies are in need of this vaccine. And if you feel that that would be your child, please talk to your family physician or pediatrician about whether or not your child is a candidate for the meningococcal vaccine. The next one would be the human papilloma virus vaccine, HPV. In the United States, we have now Gardasil 9. HPV is a virus that causes genital warts and also causes cervical cancer, cancers of the pharynx, which is the throat and the mouth, and cancers of the anus. This is a sexually transmitted disease. It's the most common sexually transmitted disease and is thought to affect up to 79 million young teens and young adults in the United States. This is a vaccine that we start vaccinating children at age 11 to 12, around that age, up to age 21 to 26. This vaccine is a series of 2 if you're under the age of 15, but if you're over the age of 15 or you have a weakened immune system, then you have 3 vaccines. The first vaccine, and then 1 month from there, and then 6 months from there. This vaccine has been shown to essentially eradicate cervical cancer if we can get everyone to be vaccinated. A study showed that if we vaccinated every 12-year-old girl in the United States, that we would prevent 200,000 HPV infections, 100,000 cervical procedures, and 3,300 cervical cancers. This vaccine has also been opened up to our male population, our boys, because of its relation to oropharyngeal cancers as well. This is a very well-tolerated vaccine. This vaccine is what we call a virus-like particle that mimics the virus capsule, so it creates immunity to it. There is some controversy about, I get a lot of questions from moms and dads saying, well, why are we vaccinating our 11 and 12-year-olds against a sexually transmitted disease? And that's a very good question, and is a common concern. The reason we do this is because we know that if we vaccinate these children years before they become sexually active, that it is the most beneficial, so that before they are ever exposed to the potential of HPV. As well as most of the time after age 13, 14, 15, most of our vaccines are done unless you're getting the meningococcal vaccine after you graduate. And so we don't ever see kids unless they're sick. And so in our mind, we think our vaccinations are young. And as we get a little older, we don't think about vaccines. So 11, 12, we're still coming into the doctor for our yearly vaccine. So we want to take advantage of that opportunity to get them vaccinated early, so it protects them in adulthood. It does not increase their sexual promiscuity at all. It just protects them for their decisions in adulthood. So the next one is the influenza vaccine. The most common vaccine talked about right now as we're approaching flu season, which is typically the highest in January, February, March. But we do start having some diagnoses October, November. It seems that often people are traveling for the holidays and kind of bring it back to our community, and before you know it, everybody has the flu or knows someone who has the flu. The flu vaccine is safe for all ages, 6 months and older. So whether you're pregnant, whether you're elderly, whether you're immunocompromised, whether you're having chemotherapy, this is a dead virus, so it's not a live virus whenever you get the influenza vaccine, which is the shot. And it's a once-a-year vaccine, and there are two types, trivalent and quadrivalent. The most common given is the trivalent, and really is the best choice. There are two types of influenza, type A and type B. Type A is the tricky one. It's the most common and can elude us the best. It's able to change strains and make itself more elusive as the years go on. And B kind of tends to stay very similar to what it normally is. Changes a little, but not as much. And so your trivalent vaccine will have 2 strains of A and 1 strain of B. And every year, the CDC epidemiologists come up with what are the most common strains that will be in our community, and they make a vaccine to that. Now, if you are exposed to, say, a different strain that is not predicted in our vaccine, for instance, when the swine flu came about, what made the swine flu so virulent was that it wasn't anticipated, so it wasn't in our initial vaccine, and then it kind of made a rise and continued on. But even if you, say, got the trivalent vaccine and were exposed to a different strain, you still would have a less likely to be hospitalized. Your illness will be shorter and less severe. You'll be able to handle that infection better than if you were vaccinated, than if you were not vaccinated. At 6 months of age, your first shot, we give you half the dose, and a month later, we give you the other half the dose. Like I said, it's safe for everyone. There is a live vaccine that's intranasal that's really kind of gone wayside in the practice of vaccinations. Has made a comeback in the last year, but it's not routinely given, so it's just the attenuated or dead vaccine that we give. It is, when they make the vaccines, cultured on an egg embryo from a chicken, and so there are concerns about people who have egg allergy, but actually the CDC, the sub-branch that deals with vaccines, states that even if you've had a severe reaction to egg product, that you can still have this vaccine. And actually continues to recommend it, particularly if you have a lung disease like COPD or asthma. Just make sure that you discuss this with your doctor ahead of time, and you get the vaccine with your physician and not at a pharmacy if you have an egg allergy, and to notify them of your egg allergy so they can be prepared. There is a vaccine for the flu that is a cell-based inactivated vaccine that's actually cultured on a mammal embryo that's not related to eggs, but in studies, actually the incidence of reactions with an egg allergen recipient was the same as the one that's grown on the chicken embryo. So basically everyone is recommended that everyone have the flu vaccine starting now. You can get it at your local pharmacy. You can get it at your physician's office. They're starting to vaccinate now, and that'll protect you through February. And so that's a very high recommendation, because each year we have a large amount of people who are hospitalized, or even deaths related to the influenza virus. And it is safe in pregnancy to give.
Great. I've heard this before. People say, I get the flu shot and it gives me the flu.
So that's a very common concern and reaction that I get from my very own patients, and this can be explained if you understand kind of immunity. And immunity is a very complicated thing, but in the basis, when you are exposed to a virus or a bacteria in the community, your body, your immune system makes antibodies, which are sort of the military that combats the bad people in your body, if you think of it that way. And it takes about 5 to 10 days for your body to form an antibody to fight an infection. And a part of your body's fight until it has an antibody is to increase your body's temperature in an effort to kill the foreign bacteria or virus. So it is actually your body creating the temperature, your fever, in response to try to kill the virus. And with that comes different things that happen in your body that causes body aches, joint pain, fatigue, chills. That's all what we call an immune response to a virus or a bacteria. And so when you're exposed and you're not vaccinated to something, say, the flu, you'll notice you're sick 5 to 10 days, and then your body makes antibodies and kills the virus. Well, vaccines take advantage of this by introducing into your body what the bad guy looks like. And so you are able to form antibodies that are in reserve, in the quiet, waiting. And so if you're vaccinated, you may experience some of that immune response, some fever, body aches, even a little runny nose, fatigue, joint pain. But it will not be to the extent as if you were actually exposed to the true virus. Okay. You will, typically that's less severe and only about 24 hours. You may have some soreness at the injection site as your body, your muscle is absorbing the vaccine. But after that, you should be back to normal. And when you're exposed to the virus in the community, which odds are you will be, your body already has the army to fight that. It comes into your body, it's killed immediately without any fever or side effect. So that, in short, is sort of the basis of immunity in vaccines and how we're able to protect ourselves. So even if you were to get a strain that was not in the flu vaccine, as I described earlier, you already have antibodies military to fight that infection, so it is less severe and a shorter course of action.
That's great.
Yeah.
So let's say I didn't take the flu shot. What's this Tamiflu that I hear everyone talking about? Can that help me?
It can. Tamiflu is one of the few antivirals out there. You'll hear your doctor often say, you have a virus, go home, supportive care, get rest. We don't have a lot of medicines for that. There are a few viruses that we do have medication for, and one of them is the influenza virus because of the danger it can pose. And so Tamiflu can be given, but it is not to the extent of benefit that we thought it would be. So at best, it may decrease your symptoms by 24 to 48 hours. And so you may still have symptoms. Having said that, the CDC recommends that we give it to patients with lung disease who have infection, who are young or elderly, so extreme of age and people with lung disease, and then someone who maybe presents with severe infection. Now, having said that, your normal healthy Cindy come in, you've got the flu, I've got to get back to work, I've got my grandkid's birthday on Saturday. Often we give it an attempt to help you anyways.
Okay.
But you can expect to still have symptoms for at least a few days after getting it. And we certainly give every patient who's hospitalized with the flu, influenza virus, or Tamiflu. So what can I do to help myself feel better if I have the flu? Supportive care. So making sure that you keep yourself adequately hydrated. Having high fevers alone can dehydrate you. And so lots and lots and lots of fluids, even if you don't feel like eating. And making sure that your chronic diseases are well managed. For instance, if you have diabetes, if your blood sugars will go high from infection, which can also cause you to be more sick, or if your lung disease, particularly COPD and asthma, make sure you're taking your inhalers, your breathing treatments, and that you're following up appropriately with your physician. Making sure that if you start to get a fever, which is 100.4 or higher, that you seek help with a medical provider in the community and get tested and get treatment and at least get assessed for complications of influenza, particularly pneumonia, that would certainly warrant Tamiflu treatment and further observation and monitoring by your healthcare provider.
I've heard that think it's 65 and older. Should they also get a pneumonia shot?
Yes, great question. So 65 and older, there are actually 2 pneumonia shots now recommended. Prevnar 13, which is actually what we give our children, and Pneumovax. And now the CDC recommends if you've not had any, the Prevnar 13 is the first to get, and then a year later, the Pneumovax. It's kind of interesting with Medicare, though, because the Pneumovax was brought in earlier and grandfathered into the policy where you can get it at your doctor's office. The Pneumovax is through your prescription plan, and so you have to get it at your pharmacy, and most pharmacists will give it to you. And so you need to order from your physician for the Pneumovax at age 65. If you have lung disease or diabetes, then you need it before 65.
Oh,
And every 5 years after until 65.
so is the pneumonia shot an annual shot?
No, so if you have no lung disease, 65, you get the Prevnar 13, and 1 year later you get the Pneumovax and you're done.
Okay.
If you have lung disease, then it's recommended that you get one every 5 years.
Okay.
So
Okay, that's great.
until 65 and
Until
every 65.
Okay. So let's move back to the shots. So I did this with my children. And hopefully you won't say it was wrong. Is it okay to give my children Tylenol before they come in?
That's a great question, Cindy. So we typically say do not give Tylenol beforehand. I know that it's common for moms and dads to want to give it knowing that they're going to get shots to decrease the pain, but actually the vaccinations are very short-lived, and most of the time kids, within a few minutes have forgotten about it. It's usually the next day that they may have a little bit of soreness there, and then at that time, it's okay to give them Tylenol. But the first 24 hours, we try not to, just because it may affect the immune response to your vaccine. Now, if you have given it, no worries. You don't have to get any extra titers or vaccinations, but we just say you don't have to. If they get a fever over 100.4, you can. But typically, I say over 101, then give some Tylenol. That's a substantial enough fever. But typically, we wait, and if they need it for pain or for fevers within that 24 to 48 hours, you can give it, but no need to treat them ahead of time.
I apologize, Maggie. I gave you Tylenol ahead of time. So your child has had a shot, whether it's the DTP or MMR. Can you describe what possibly could be some signs that maybe they're having a reaction that's not just a typical maybe fever afterwards, that maybe they need to get in touch with you?
Gotcha. Okay. So typically within 24 hours of most vaccines, the symptoms can be a low-grade fever up to 101, fussiness. A lot of times babies can't tell you what they're having, but typically it's fussiness, maybe decreased feeding, but still feeding well. Occasionally some loose stools, fevers, runny nose. Those are typically common symptoms, and just some love and care, and continue to attempt to breastfeed or bottle feed the best that you can. But another common side effect that you should still notify your physician about is if they get a local area of redness. That's something that at least the nurse should take a look at. It's not a contraindication to future vaccines. It is not considered an allergy. It's a local response to the vaccine, and that will be a raised red tender area. It's not considered an infection. Typically, you can just notify your physician that it has occurred so they're aware, and put a cool compress on it, and it should go away within 24 to 48 hours. If you have persistent fevers over 101 despite Tylenol or Motrin, if you have persistent vomiting, not feeding at all, that's also of concern. So if you have swelling of the face, wheezing, trouble breathing, swelling of the mouth, anything unusual like that, then go to the emergency room.
Okay.
So, but having said that, that is an extremely, extremely rare side effect. Less than 1% of the vaccinated population will have some sort of life-threatening reaction. And, when we talk about risks for our pediatric patients, you're at much higher risk to obtain an infection and get, some life-threatening sequelae of that than to get the vaccine. You're even at much greater risk putting your child in the car to take them to soccer. So.
Right. Say that someone didn't take their child in to get shots, and now they're 15 or 18. Is it too late to get the DTP and then?
Right. It's actually never too late, particularly if you are an unvaccinated teen about to travel the country. Here you're in this safety bubble of what we call a herd immunity, where most people are vaccinated, but you'll find in other countries that is not the case, and you will not have that protection. And even in certain located areas in the United States where people are less vaccinated, you'll find that those infections that are much less common now are now back on the rise because of lack of what we call herd immunity, where everyone around you is vaccinated, so you're protected. But when more and more parents are counting on herd immunity, then that alone weakens herd immunity because less and less people in those communities are vaccinated. That is typically found in small groups of people, small cultures of people in the United States. And so that's where you'll see the rise of measles, mumps, rubella, that kind of thing.
Because I've been here and there's a mumps outbreak somewhere or something, or whooping cough.
Yeah, and you'll see in little out groups of homeschool communities, not that all homeschool, but a lot of homeschool communities don't vaccinate their children, and thinking that they're safe because they're homeschooled and not out and about, but really they're with the other people who are not vaccinated. Yeah. And so you're actually safer in the vaccinated pool of people. But if it's never too late to vaccinate, particularly if you plan to travel, you can get with your primary care doctor. The CDC will have, if you look up wherever you're traveling, what the recommended vaccinations are, and you can get vaccines, particularly if you decide to do a career in healthcare. There are certain vaccines, for instance, a hepatitis B vaccine that you need, which is a series of 3 that you can get at any time. There is a rise in pertussis, largely related to the decrease in immunity after our teenage years. And so there's a new recommendation for all pregnant mothers to get a pertussis vaccine, which is typically in our DTaP, which is our diphtheria, tetanus, pertussis vaccine. And for all grandparents to also be vaccinated, because if they were vaccinated in the past, that may have been weakened as we age. And so it's recommended that anyone around a newborn get their pertussis vaccine. And so it's never too late to get vaccinated for most vaccines that would cause you potential harm.
Is that the whooping cough?
Yes.
Okay. So what are the recommended shots that you should be giving your babies? The DTP, how many of those do you get? And the MMR, is it?
Yeah, so if anyone is curious, the CDC, you can simply Google CDC child immunizations, and they'll give you not only the recommended child vaccination record, but also a delayed vaccine record.
Great.
It is recommended that you get your vaccines at 2 months, 4 months, 6 months, 9 months, 12 months. And then there's a couple of vaccines, and then some big vaccines at 4 years of age, and then it kind of wanes after that, other than the flu every year.
Right.
And then around 18, at least, the meningococcal vaccine. But there are, if you are worried about the amount of vaccines, there are alternatives. If you're going to go with vaccine or not vaccinate, at least consider the alternative route of vaccinations, where they're slower. You can get any number of vaccines at one time, but once you get them, you have to wait 30 days before you get the next vaccine. So if your child is behind on vaccines, I encourage you to contact your healthcare provider, and they can get you started on a catch-up schedule. So
that's great.
Yeah.
This is my curiosity. The polio, is that in a shot or is it oral?
It is in a shot. It's a combination shot at 2 months and 4 months. The oral vaccine is the rotavirus, which is just a little sweet solution that they drink, 2 separate doses at 2 months and 4 months. Rotavirus is the most common cause of diarrheal illnesses in children related to hospitalizations. They can have substantial amount of diarrhea and just are simply unable to keep enough fluids down to maintain it, and often end up hospitalized for IV fluids. So rotavirus would be, not a mandatory one, but definitely a recommended one.
So up to the meningococcal shot, what's the difference between viral and is it bacterial meningitis? Does that shot cover both those?
Okay, good question. So there are 2 main types of meningitis, which we say that is an infection of the lining of the brain, of the neurological system. It can cause high fevers, confusion, seizures, rash, altered mental status, and severe illness, even a comatose state. Often that presents with high fever, severe headache, and what we call nuchal rigidity, which is a neck stiffness, and not just I slept on my neck wrong. It's I can't move my neck from the severe pain that I'm in. And that is typically bacterial or viral. The meningococcal vaccine covers you against Neisseria meningitidis, which is a bacteria, which is the most life-threatening form of meningitis. The only real way to know which type of meningitis it is a hospitalization, a procedure called a lumbar puncture, where they get fluid from your lower back, similar to when moms get epidurals when they're pregnant, but they get fluid from their back and culture it and test it. If it's a viral meningitis, most of the time that is self-limiting. It does cause high fever, illness, but does not have the increased mortality and morbidity like bacterial meningitis. So bacterial meningitis is the dangerous, life-threatening bacteria that has to be treated in the hospital. Viral meningitis initially starts out in the hospital for diagnosis, but often can go home when they're stable and get further supportive care at home for most healthy adults and children.
Well, why is it in groups, like you say, college kids in the dorms or the military? I didn't even realize the military. Is it that contagious? And how is it my drinking out of the same cup with you, or how are we? Why is it because we're in a group that it's
sure?
Like that?
So by most time, it's particularly with Neisseria meningitis, the same with influenza, it's through the air. So you can inhale it, you can touch it on surfaces and ingest it. And so particularly when you're in a tight quarters, that can move rapidly throughout a community. Before someone often even knows they're infected, they've already infected someone else. And so that's the importance of getting vaccinated.
So do you recommend that shot for anyone, or are those groups are the higher risk ones, but would you recommend just anyone get it?
Yeah. So I do, starting at age 11 to 18, it's recommended for anyone to have. Yeah, but particularly those people going off to college or in groups like the military. But it is a recommendation for anyone to have that will protect them in the future for exposures.
Is it a one-time? So
It's one time.
So someone in their 40s, if they wanted to get it, it would help them?
Mm-hmm. They could get it. Most often we do it from 11 to 18. That's what the CDC recommends.
Okay. So, really, that's all the questions I had. I learned a lot about meningitis and stuff like that in the shots. And I did wrong by giving Tylenol.
Not too bad. You did right by getting the vaccine.
So did you have anything else that you wanted to say or anything like that?
Just that, I encourage you that if you've listened to this live Facebook chat with us and you have more questions about vaccines, whether or not you or any member of your family needs vaccines or up to date, I encourage you to contact your healthcare provider, have a discussion with them, make sure that you and your family are safe and covered.
Great. Thank you. We're going to put some contact information for Dr. Vonfeldt up here. She is opening a new clinic starting
November 1st.
November 1st.
Yeah.
Duncan Family Medicine with Dr. Melissa Hurst, and they're at 2120 West Elk Suite 8. I'm reading it backwards. Thank you. I really learned a lot. And like she said, if you please go to your healthcare provider if you have any questions, and keep an eye out for our next Facebook Live.